What is sleep apnea? Sleep apnea is a potentially serious sleep disorder in which the breathing repeatedly stop and start. If you snore loudly and feel tired even after a full night of sleep, you might have sleep apnea. There are many types of sleep apnea. Obstructive sleep apnea, the more common form that occur when throat muscle relax. Central sleep apnea, which occur when your brain does not send proper signal to the muscle that control breathing. Complex sleep apnea syndrome, also known as treatment emergent central sleep apnea, which occur when someone has both obstructive sleep apnea and central sleep apnea. If you think you might have sleep apnea, see your doctor. Treatment can ease your symptom and might help prevent heart problem and other complications. What are the symptoms? The sign and symptom of obstructive and central sleep apneas overlap, sometimes making it is difficult to determine which type you have. The most common sign and symptom of obstructive and central sleep apnea include loud snoring, episode in which you stop breathing during sleep, which would be reported by another person, gasping for air during sleep, awakening with a dry mouth, morning headache, difficulty staying asleep, excessive daytime sleepiness, difficulty in paying attention while awake, irritability. When to see a doctor? Loud snoring can indicate a potentially serious problem, but not everyone who has sleep apnea snores. Talk to your doctor if you have sign or symptom of sleep apnea. Ask your doctor about any sleep problem that leaves you fatigued, sleepy, and obstructive sleep apnea. Soft tissue of throat, obstructive sleep apnea. This occurs when the muscle in the back of your throat relax. These muscles support and palate the triangular pieces of tissue hanging from the soft palate, uvula, the tonsil, and the side of the wall, throat, and the tongue. When the muscle relaxes, your airway narrows or closes as you breathe, and you can't get enough air, which can lower the oxygen level in your blood. Your brain senses your inability to breathe and briefly rouses you from sleep so that you can reopen airways. This awakening is usually so brief that you don't remember it. You might snort, choke, or gasp. This pattern can repeat itself 5 to 30 minutes or more each hour, all night, impairing your ability to reach the deep, restful phases of sleep. What is central sleep apnea? This is less common form of sleep apnea occur when your brain fails to transmit signal to your breathing muscle. This means that you can make no effort to breathe for a short period. You might awaken with shortness of breath or having difficulty time to getting sleep or staying asleep. What are the risk factors? Sleep apnea can affect anyone, even children, but certain factors increase your risk. Obstructive sleep apnea. Factors that increases the risk of this form of sleep apnea include excessive weight. Obesity greatly increases the risk of sleep apnea. Fat deposit around your upper airways can obstruct your breathing. Neck circumference. People with thicker neck might have narrower airways. A narrowed airway, you might have inherited narrow throat, tonsil, or adenoid can also enlarge and block the airways, particularly in children. Being male, men are 2 or 3 times more likely to have sleep apnea than are women. However, women increase their risk if they are overweight, and their risk also appear to rise after menopause. Being older, sleep apnea occurs significantly more often in older people.